Good morning, world. Although ADHD has come a long way as far as the information that is out there, there are still some questions that people have, and that is why today I wanted to do five frequently asked ADHD questions. One being, should I take the medication? Answer is that it's a very personal question. It's up to you. It depends on what have you done to address your ADHD symptoms before the medication. Have you attempted to use the behavioral changes? Have you given the dietary changes, the dietary options a shot? And are there other medications that you're taking that may interfere with the ADHD medication? All those things will go into play. So it's something that you're going to have to ask yourself and evaluate what else is going on in your life to determine if that is the right route for you. 2, why isn't the medication working? ADHD medications are finicky, as I have said before. It requires that you have the right dosage of the combination of the right dosage of the right medication in order for it to work. But the most important reason that often medications don't work is that people don't take them as they should. You need to be taking the medication as prescribed, meaning that you're taking the dose that is prescribed and you're taking it for when it is prescribed. That means that if you have a morning medication, you're remembering to take it in the morning. You're not just at 5 o'clock when you remember taking it. You have to be consistent and you have to follow the prescription. So with that combination, right dosage, right dosage of the right medicine, and you are taking it consistently, it should give you a much better result. 3, if I'm taking medications, do I need to go to therapy? Again, medication can help stabilize your hormones. It can help make you more ready, it helps make therapy easier on you, but it does not teach you the skills, the skills that you learn in therapy. Therapy helps you manage the symptoms. It helps you find ways to work when the symptoms are there. And a lot of times what I have found is that over time, people with ADHD have created a system that is working for them. And when things start flowing enough, they have been able to taper down on the medication, go to a lower dose. But generally, the medicine does one thing and the therapy does one thing. The combination is awesome. 4, should I tell people I have ADHD? It's up to you. You can never untell a person something. So once you've decided that you are going to speak with someone and share that information with the person, make sure it is a person that you can trust with that information and that this is something that you are comfortable sharing with that person, because once you tell it, it's out there. And understand why you want to share that information, because sometimes people use their diagnoses as a crutch. ADHD is not one of those things that you should be using as a crutch, because there are a lot of resources out there, ways to help you thrive with ADHD. So sharing that you have ADHD with your boss can help you get the certain accommodations to be able to do your work. It can help them learn how to best work with you. But again, figuring out why you want to share that information. And then, of course, make sure that you're sharing it with a person you trust with that information. 5, if I'm doing all these things, why isn't it work? Why am I still off? Why are things not working? A lot of times people find themselves doing a whole bunch of stuff, especially with the internet these days. There are so many things out there, and there are so many people saying this, that, and the other, and people go and they try everything. Trying everything does not necessarily mean that you're doing the right things for you or the right things for your symptoms. If your issue is that you can't stay focused and someone tells you to do something else that's about, I don't know, whatever, I can't think of something right now, but make sure that the task matches the desired accomplishment. So if you're working on staying focused, you should be engaging in tasks that help you stay focused. If your issue is maybe you need a quiet space just means that you gotta go. You can't have an office at the front of the building. You need an office in the back. All these things go into making sure that the things that you're doing are being done for the right reason, and that the reason being to achieve what you want to achieve. Quick recap. 1, should I take the medication? It's up to you. if you tried the non-medicinal things, the behavior things, and things that and is there any medication that you're taking that could interact with ADHD medication? Things like that. Discuss it with your doctor to make sure that you're set for before you decide to go forward. 2, why isn't the medication working? We have to make sure first you have the right medication and the right dosage of it, and of course that you are taking it as prescribed. 4, should I tell people I have ADHD? It depends on your reason. If you tell people at work, if you tell your boss, it may help you get some accommodations, but it's not guaranteed unless you meet the right ADA requirements. But once you tell people, you can never untell. So make sure that it is something you want to share, and you are sharing with the person you want to share it with. If I'm doing all these things, why isn't it working? What are you doing? We need to make sure that you're doing the right things to address the right symptoms, because a lot of times people have a tendency to move around and do a whole bunch of stuff, but not necessarily the stuff that addresses what they want to address. So you have to make sure that those two are matching. And that would be it. Cool. That was quick. Good morning, world. Have a great day.